and enjoy the benefits of having the implants.
Okay, let's start with the lower denture. What's the main advantage then?
That lower denture.
And how many implants? Let's start with the least amount to the, I guess, getting all your teeth back.
Yeah, Randy, the lower denture is, a big problem. The lower jaw moves. We have this big muscle called the tongue that wants to kick that lower denture around. And that thing's almost impossible to control for most patients. So what the dental implants do, and even a few dental implants, can secure their current denture or a new denture in place and allow them to chew and eat. This is a good example of that. For example, this is a lower.
This is a lower denture.
Lower denture. And here we have just 4 implants that have been placed. And then we take the teeth, and they can lock the teeth in.
Okay, let me feel this. And how accurate is this, by the way?
Very accurate.
Okay. Now this is, I'm not exaggerating here. I can't even take it off. Okay. Do they have a tough time taking this out of their mouth?
No. Even my arthritic patients, I can make them to where they can take it in and out.
So you adjust how tight it is?
Absolutely. And some want it very tight. Some people really want that secure, and I can adjust that for them.
So anybody watching this lower denture, this procedure, 4 implants, snaps in, snaps out.
Great.
What about chewing? I mean, what
procedure.
can they eat? They have to be careful.
No, they can eat anything they want with that. They can go back to having a healthy diet.
I mean, corn on the cob?
Corn on the cob, you name it.
Steaks?
Steaks.
Do they tell you that? I mean, tell me what they say.
They say, Doc, if I had to go back to having a denture again, I don't know what I'd do. I mean, they really are that attached to these implants and having those new teeth and the confidence that they have of having their teeth secured again.
One of the statements you made, you said, Randy, if there was a try-in period for these denture wearers, they couldn't go back to their denture.
There's absolutely no way they would ever go back to a regular denture or partial after having implants again.
What are the frequently asked questions? On day 1, the denture wearer comes to you. What do they want to know?
How long is it going to take? How much does it cost? And how much pain am I going to have to go through?
Okay. Is the pain usually the biggest fear? And we just talked about it, but...
Yeah, it absolutely is. There's a huge fear keeping people away, and really that doesn't have to be anymore. I mean, dentistry has progressed so much that people have these mental tapes in their head of bad experiences in their childhood, or they have a friend or relative that had a bad experience with dentistry, and they play those tapes over and over.
My mother's 73 years old, pretty healthy. Mm-hmm. She has been wearing dentures since she was 28. I told her about you. She says, I'm too old. There's no way.
Never too old.
Really?
Never too old. I mean, it is such a quality of life improvement. And this is done so simply and non-invasively today.
We've talked. You say this is the easiest type of patient for you, is a denture wear.
Absolutely.
It's a straightforward procedure, you're saying.
Very straightforward. I mean, it's no one. In fact, I stopped making lower dentures because it's damaging to the bone, and nobody really talks about that. And nobody's happy with them. Why do something for a patient that they're not going to be happy with?
When will this become mainstream? I mean, is this the future of dentistry where dentures will all be secured by a couple, 4 implants or whatever?
At least a couple of implants are needed in all of these cases of patients with a lower denture.
What about mini implants? I see a lot of that in the news. What are your thoughts on that?
Mini implants are certainly better than a denture, but I really, in my practice, have focused on the traditional implants.
You think they're stronger? Well, obviously stronger.
I think they're stronger. You're able to chew so much better with the implants that I really think that you need their traditional implants to give the strength to your bite and to your chewing.
What about people that want all their teeth back, or they want something that's permanent?
Absolutely.
In their mouth.
And more. When I first started doing this back in 1995, more patients wanted the lock-in, lock-out style of teeth, and that's really changed over the last 16 years. Today, everybody wants their teeth fixed. They don't want to have to take them in and out if they can possibly.
How many implants for that? Because that sounds like the way to go.
Right. On the lower jaw, if they're missing all the teeth, it's as little as 5 and as many as 7 or 8. Yeah.
That's it.
It doesn't have to be 1 tooth per implant.
And some of these are that no cutting or no flap or what is the expression?
Well, it's guided surgery. 85% of the patients today are no incision, no stitch procedure, or the guided surgery. 15%, we have to take teeth out and clean infections from the gums and bones, and they have to have the traditional procedure. In the upper jaw, usually for lock and lockouts, I like between 4 and 6 implants for the lock and lockout.
Okay. So what do you do for the upper? Same thing? We're talking about the same thing.
Yeah, they can have a lock and lockout, and that gets rid of the palate versus a traditional.
What do you mean by that?
The palate of a denture, Randy, let's take a look. Let's take a look at this picture.
Okay.
A traditional denture covers the palate, which is the roof of the mouth on a person. With dental implants, with either lock-in, lock-out style or fixed style teeth, they don't have that anymore. So they can enjoy their foods. They have more room for their tongue.
Interesting. That's right. Okay, so their palate is covered.
The palate is covered, and there's some taste buds up there, and it takes away a lot of the enjoyment of eating when the roof of the mouth is covered.
So what do you do? I mean, you take it looks like a denture, and there's just snaps inside.
Absolutely, it'll snap right on and off. And there's 100 different, and these are tough to get on and off. They're that secure, but they'll snap right in. I mean, they rest right on this bar, and the bar puts the chewing.
Take a look at these snaps.
Sure.
Who does this? You send these out? You
the
do
Dental
these?
Laboratory.
Okay.
I happen to use one of the finest laboratories in the country, Root Dental Laboratory, and they're amazing. They've been doing this for over 40 years. We have hundreds of different ways to secure these to the implants.